welcome back to Fox 43 AM Live. Join us now is Bill Persinger, CEO of Valeo, and Kathy Mosier, CEO of Family Service and Guidance Center. Good morning, guys.
Good morning.
Thank you.
No, thank you. It's always a pleasure having some new faces on the show for you guys, representatives, but it's wonderful to, change things up a little bit. And now you guys are here because you've announced that both Valeo and FSGC have been approved as certified community behavioral health clinics.
That's right.
But now, what does that mean? Because I know you guys are super excited about it.
Well, just a little bit of backdrop. So Valeo is a community mental health center serving Shawnee County. Of course, our partners down the street, the Family Service and Guidance Center, also a licensed community mental health center serving children and families. That won't change. We're still here for people. If someone comes to the Guidance Center or to Valeo, they have a counselor, they have a therapist, they have a prescriber, a peer support worker, they have crisis services. Those aren't going away. In fact, they'll be enhanced. And so I like to tell people the good stuff that we're both doing is just going to get better. And so we're just pleased to partner up with the state of Kansas, along with our city and county partners, to continue to provide public mental health and addiction services. So, new things coming, enhanced care, better access, more services, more counselors, more case managers. Kathy?
Yeah, this certification really affords us access to become and adopt the gold standard model of care nationally for mental health. So we're excited to bring that to Shawnee County and our region, and serve from family service to Valeo, all ages. We cover the whole gamut. So it brings comprehensive services. It really builds on what we already do, affords us more training, professional training, and more best practices that get the best outcomes for the people that we serve. So it's a really exciting thing for the community as well.
That's great.
Kathy said it yesterday. The emphasis is on non-four walls. I mean, we both do a lot of work in the community. Nursing homes, schools, and we assist people who are homeless. We're involved in Impact Avenues to help families that have children who are homeless. But this will enhance our capacity to get out there in the world a little bit more, where the people are.
We can embed our therapists and services into the schools where the kids eat, live, and breathe every day.
Exactly.
And that helps them, the ones that aren't making it through our doors. We catch more of those that prior to this were falling through the cracks. So we'll be able to serve more people as well and increase our staff to meet the need. It's a growing need in our region.
True, and our clients who have transportation problems, we can have more staff to supplement the home-based services that we provide now. And really the whole focus is whole person care, mind and body.
That's amazing. I love that.
Great time.
Yeah, like I said, things aren't going to change. Things are or change for the better, really. Expanding, more reach. That's absolutely fantastic. And I'm curious, what did it take to get certified? How did that come about?
A couple of years of hard work, Kathy.
Absolutely. There's a lot of requirements. A lot of one of the linchpins is being able to build those strong collaborative working relationships with our community partners. We're going to be focusing on the whole persons and addressing all their needs. So if they have a identified physical health doctor and the physical health needs and their behavioral health needs, and blending those together into one comprehensive plan, helping them to follow through. For instance, instead of just a referral to a doctor, we'll be able to say, do you have transportation? Do you need help setting those appointments up? And then we follow up and say, okay, so how did your appointment go? Did you get what you needed out of it? And what are the next steps, and do you need any help with those? So it really makes the all health, no matter what system you're using and what community partner you're using, the ability for us to help them navigate the system, because that's not always the easiest thing to do.
We wouldn't be able to springboard into this transformation, which is happening all across the country. Mental health agencies and substance abuse agencies, mainly nonprofits, all across the country are transforming and enhancing their services. But we would not be able to springboard into this if our city, county, and state partners and federal hadn't been there for us the last couple of years. If they hadn't been there for us, we wouldn't be able to do this. Grant funding for mental health has increased in the last 2 or 3 years, and it's very heartwarming and very encouraging to see those partners step forward and help us fund this project with their support. It's outstanding. First time in my career I've seen city, county, state, and federal government line up all together to support mental health and addictions treatment, particularly for people who are uninsured and can't afford the cost of care. Our government partners have been outstanding.
Amazing. Well, thank you guys for joining us today. It sounds like it's going to be a bright future for the area. Yes. Thanks to you guys, and thanks to the community helping you guys and support. It's been great the past couple of years.
Thanks for helping us get the word out.
And of course, to learn more, you can visit valeotopeka.org and fsgctopeka.com.